Welcome to HealthTech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, I am excited to welcome Syed Siddiqi, a healthcare innovator who is making waves in digital health transformation. As the founder of American Journal of Healthcare Strategy and administrator of Jefferson's Health Facial Plastic and Reconstructive Surgery division, Syed brings a unique perspective on healthcare administration and digital innovation. His work as legislative ambassador with American Cancer Society and his role in building a 12,000 plus member healthcare community showcases his commitment to advancing healthcare through technology and policy. Welcome to HealthTech Heroes, Syed.
Yeah, thank you for having me. I really appreciate being invited on. I really appreciate the work that you're doing to really highlight changes in the health tech industry. So yeah, it's an honor to be here.
And it's my honor to have you here, Syed, the things that you have already achieved and things you are going to achieve. And I'm excited to be a small part of your journey here. As we are talking about Health Tech Heroes, I think it's important to start a hero's journey with the origin story. So my question for you is, what inspired you to create the American Journal of Healthcare Strategy, and how is it reshaping digital health communication? What's your origin story? What brought you here?
Yeah, that's a good question. So the journal was founded back in September of 2023. About a month or two earlier, doing my work at Jefferson Health, I noticed some issues that could be resolved. And after implementing a few projects, I decided that it would be very beneficial for the industry and for patients if other institutions could also implement the exact same strategies. I didn't find a way to share our successes with the broader healthcare world. And I decided, why not create a community where we all find solutions to major healthcare problems, the most common issues, and really just help each other to create a change and really improve patient outcomes.
That is awesome. So this was, as you're working with the Jefferson, this was something that you created as a side project that took on its own life. And this is now pretty much a network of 12,000 healthcare professionals. Is that what it is, and growing?
Yeah, no, it's really impressive how it really shaped up. So like I said, I implemented a project. 1 to 2 months later, I launched American Journal of Healthcare Strategy. So
Okay.
this is my first company. It's sort of went on to it spontaneously. It might have been better if I had some planning going on, but I think something very valuable about the journal is that I didn't go into it without any planning. I sort of went through it and decided figure it out as we went on. A lot of things that really shaped the growth, 12,000 members, is really just constant feedback from our community on how we can improve things, and it's really the members that do majority of the work, where they come into a solution, so say you're doing something really special in the state of Washington or state of New York, providing a community or a platform to really share what you're working on. I think the majority of the work is given to those that are the founders of that idea, of that innovative solution to a major problem in the healthcare industries. I'm very appreciative of our members. We're really making a difference together. And like I said, we went in without any planning. But we're all figuring it out together. So that's what the journal's really all about.
That's impressive. I'm sure there were some obstacles early on, and seems like your members actually not just came there for solutions, they brought solutions for the journal itself, besides the solution for the problems they were trying to address. So can you name a couple of obstacles that you faced in your earlier days? It seems like even now it is the earlier days for this journal, although it has done. Any insight on how you solve those?
Yeah, so there have been many issues in the beginning. So like I said, I launched it around three quarters way through 2023, and I was 23 years old at that time. So I was going into this blind, like every other company, we start with 0 followers, uh, really trying to prove how important a journal is into the healthcare field and really gaining the trust from other members in the industry. That's been a challenge. It's not easy coming as a 23-year-old with no support, no following really, and saying, hey, this is going to be big. There's not really any proof. We were able to find several individuals very, very early on that were able to overlook the following, the founding, and they really focus on the mission of the journal and what it's trying to accomplish. And I think till this day, even many people focus on really the mission, and that's really what it's all about. Something that really sets a journal apart is that we take a step away from traditional academia. Many academic journals, they try to focus on where the researcher came from. If you're not, say, PhD level or MD level, your insights are usually less regarded compared to other individuals. We took a step back and we really thought about what is the healthcare industry supposed to address? And our answer to that was really patient care. That's what it comes down to. We're all patients at the end of the day. The doctor treating you as a patient to another doctor's. I think really finding solutions and inviting those individuals to really share them. So that's something that we're doing different. We've had some patients shared our own stories, although they might not come from a traditional business background or medical background. I believe that they do have ideas that could really make a change. Say in a retail industry, you're always taught to listen to the customer first. I find it interesting that in healthcare, we don't listen to the patient first. We listen to those with a fancy degree first. So that's something that we're really trying to do different, and people believed in that mission, and that's really what helped us grow substantially over the past 2 years. And our growth rate is really impressive, and I'm really excited to see where things go from here.
Yeah, I must admit, your wisdom belies your age. And I am so glad that you did not let your, like, hey, you know what, you're too young to have a terminal degree at this point. I understand that too. And you did not have that as an excuse. You did not have an age as an excuse. And you just said that, hey, this is the need and patients need to heard. And you created this journal. Kudos to you.
Yeah, and it's not
All right.
really
Yeah.
something where fancy degrees aren't needed. Sometimes you do need that. So say someone submits something to us. I was an undergraduate at the time of the launching, and I'm not able to peer review a doctorate level work. Maybe it does make sense in some areas, but even if I do peer review, there should be a second review of another either higher level or similar level, or someone just experienced in that field. So I think it's very important. We were very fortunate to have several board members come along with these titles, and they were really able to help direct us on what academia currently is. They understood what we want to make it, and they were sort of the bridge on how we can go from the current standing to where we want to be. So I'm truly grateful to all of them.
That's wonderful. So looks like there is something that sparked your interest or a solution-based approach during your experience at the Jefferson, at the plastic surgery during
Right.
that time with Jefferson, right? So my question is, Jefferson Health? What is that specific thing, that solution that sparked your idea, right? Can you elaborate that, and how did that solution become a catalyst for something like this?
Yeah. So I'm very fortunate to have several mentors here at Jefferson. They really directed me. I told them my goals in healthcare administration and management, and they really helped me by giving me certain projects. They really helped me choose which projects I want to work on, what I find interest in, and either be mentored in that project or letting me lead on my own. So just being exposed to these multiple different projects. So it's easy to say you want to go into healthcare administration, but it's such a broad field. You could be working in outpatient care or inpatient care, and all of these different areas in health administration, they come with their own different skills and different motivations to really succeed in. So just the exposure in so many different areas was really beneficial early on, and really just all these projects and motivated me to develop, well, first of all, to gain interest in the field of healthcare, and second of all, to develop a platform where I could sort of help improve the industry rather than simply helping it truck along. I could really make a difference for future generations.
And this is an amazing start. So it seems like it was not one project that sparked it, is the combination of all the projects and all the issues that you're seeing at a macro level from a strategic point of view. Then you notice, okay, there is a need for a consistent word or consistent uh, platform where we
Right.
can all come together for a solution.
I think it was sort of building upon it. So, like I said, I did work on several projects. There was this one specific project that worked with patient wait time that I was really appreciative of, and I thought this could really make a big difference. I was talking to my father on the phone, and he said, "You should publish your findings." And I was like, "That's not a bad idea. You know, it'll be good to document it. You know, see, put some key figures in there and really measure how beneficial it was." But when the time came to really find a place to promote this research study, I couldn't find anything. So I would say it was building upon, but that one specific project and that one idea from my father, I'm sure he was just talking just generally, you know, he didn't think I'd actually go ahead and do something like the American Journal of Healthcare Strategy. But I think that was really the final spark that led to this organization.
That's brilliant. So, do you have this legislative ambassador of American Cancer Society where you had a role in policy and technology intersecting? What was that experience? And based on that experience, what do you think the biggest problem between the intersection of policy and technology is going to be?
Yeah, just jumping back to the previous comment, the project was mainly about patient wait time, and I found a doctor doing a bunch of different administrative tasks in the middle of clinic, and we were actually held back by several minutes. You know, they sort of built on it. Something I found that was sort of revolutionary, at least I thought so as a young professional in the field. It was really just a matter of taking those administrative burdens away from the provider and really keeping those for the administrative staff, because at the end of the day, that's what healthcare administration is about. You know, you want the doctors and nurses and really all the clinical staff to focus on exactly that, the clinical side of things, while the administrative guys can focus on the administrative sides. Obviously there will be some overlap, but you'll never find an administrative professional doing some clinical work.
Yeah, yeah, definitely. You don't want that for sure. Yeah,
Yeah, and
yeah,
I
I
think it
think,
would
yeah.
be a little too much to ask a clinical professional to do some sort of administrative work, apart from, say, some high-level decision making. But that's what administrative professionals are there for. Just realizing that specific outlook on how things should function within the clinic, it really decreased patient wait times about. Although it seems minimal, it was about 6 minutes per patient. We saw about 40 patients a day, so you can do the math on that on hours we were able to save in just one clinic day. Going to your next question, yeah, so I was able to get involved with the American Cancer Society. I joined as a legislative ambassador, and at the time, I didn't know much about it, but as soon as I had a phone call with one of the representatives from the Pennsylvania area, I was immediately sold. Basically, we advocate for cancer reformation. And there are a variety of things, say access to MSED for testing, access to pay time off for general minimum wage employees, things like that. I think that those are very important for those patients that are going through cancer, because fortunately I don't have cancer, but it's easy to empathize with those that do and the mental burden that comes with that. So I saw it as a great opportunity, you know, to not only that, but also work with state lawmakers and also national lawmakers to create this sort of change. So that was very beneficial. For the technological aspect, I think there will be a lot of regulations involved, especially as healthcare moves to a more sort of like a smart hospital in a way where everything is sort of aligned with each other and everything is communicated from parking to being seen by the doctor. It's all to even checking out. It's all connected. I think given the patient data that's involved, the information really needed, I think there will be a lot of regulation. So I'm excited to see where we go with further reformation and seeing how things can develop that do not obstruct patient care, but actually do what it's supposed to, which is improve it and make it easier for the hospital staff.
Six
Right.
minutes, right? Yeah, 40 times over a day. I understand when you say American Cancer Society, you're looking at a policy at a macro level, but then how do you implement at a at the ground level. My next question is going back to your undergrad, where you did do your neuroscience. Does it affect your decision making?
I would say that it provides me the basis of clinical information. I think the basics of it are very important in what we do. I think it's very difficult to work in healthcare without at least some general knowledge on the clinical side of things. Neuroscience majoring in that was actually very beneficial in that aspect. It also sparked some early interest in the field of healthcare that motivated me to really stick to it and even form a company in that industry. So I would say that that was the benefit. As far as the details of neuroscience, working in plastic surgery, there is some overlap at times. We coordinate with a bunch with the neurosurgery division, but specifics on like the frontal lobe and things like that, I wouldn't say I use that on a day-to-day basis, but
Okay.
useful information to know.
Yeah, absolutely. Sometimes, yeah, I had my undergrad in microbiology, master's in microbiology, PhD in microbiology, but mostly focusing on oncology now.
Right.
But it does help. The scientific training, the idea, the clinical thought processes, it is pretty cross functional, I would imagine. So
Yep.
I see the benefit there right away. So coming back to AGHCS, is there any other way you say it? American
Uh,
Journal, AJHCS.
Funny story actually. So we were trying to go with AJHS. Unfortunately, that domain name was taken. So I was like, the entire company name, or should I keep AJHCS? We just ended up keeping AJHCS. It might be a one too many letters, but it clicked on.
All right. So, a couple of questions for you. I would love you to share what are the biggest challenges AGHCS has now, and the second question is, what is the biggest success? Like something that you want to really share, you're excited about with your journal. Yeah, the challenges
Yes.
and the success. Yeah.
So I feel as if challenges are always ongoing. It's like you put one fire out and another one to start. But really, like I said, we jumped into this with very little planning, figuring it out as we went. I'm glad to say that the challenges now are more standard than they were in the beginning, since the team is just more knowledgeable and we have some great mentorship going on. So I think it's much easier. One challenge that I can say is that we want to move away from traditional academic publishing, where say a researcher writes a paper, right? They get funding to conduct research. They write this entire manuscript. They pay to submit this manuscript to a journal. They get accepted and then it gets published. I want to move away from that traditional method. Something that's really big that we've stuck with is it's a very important value, probably the most important, was reducing any barrier to healthcare knowledge. And what I mean by that is we don't want to charge any author who say you have some grand idea, but you can't share it solely because of funds. We don't want that to happen. We don't want that to be a barrier to knowledge. So we don't charge any authors or guests to really submit anything or share anything from their own work. Another area is we don't charge any of the readers because, like I said, hiding some important work behind a paywall is just it's another barrier to really accessing knowledge. And I don't think knowledge should be costly, one article at a time. I don't want to pay $1 per article. I think it should definitely be free. So that's something that we've been trying to do. And trying to implement these different techniques, it definitely becomes difficult where you have challenges that no other publication is facing because, like I said, they have the support from authors, they have the support from readers. We don't have that sort of support. So finding alternative revenue streams is definitely a big challenge, but luckily we have some great sponsors who really support the mission of AJHCS and they keep it going, really. So I would say that's a challenge that we're lucky to overcome on a daily basis thanks to our supporters. One success I am also really proud of is just when I received the first edition from a patient. I would say that was a game-changing moment, not only for the journal, but also for me personally. I reached out to someone I met through American Cancer Society, and she was more than happy to share her experiences. She says she went through a very tough time navigating the healthcare industry as someone who just doesn't have the technical knowledge on how the industry works. We wish it was very simple. It's not just going into a store, buying a product and leaving. Once you factor in insurance and just waiting and where to go, scheduling times, being seen an hour after your scheduled time, things just get much more complex. So her sharing these ideas and some solutions that she believed would be really, really helpful. She followed up with multiple doctor offices, and she was able to see what one office is doing that the other isn't, and what the previous hospital clinic is doing that this new one isn't. So really trying to see these areas from the lens of the patient themselves who have no experience in really working in the healthcare industry. I think that was very valuable, and I really saw it as very game changing. She actually messaged me and she shared how grateful she is that I'm actually giving her a voice in this discussion on how to reshape healthcare. People usually would not even take a look at it or her thoughts. So I think that was a very important success of the journal.
I think this brings back that conversation that you had initially, where you said in a retail market, we want to listen to the customers, but here we don't listen to the patients. I think this brings the whole circle back to actually listening to the patients. My thought process when I heard about HCS was that it's written by people who are in strategy, by experts, but looks like you are bringing in direct patient voice as a publication, as a note for experts to read. So that is a really beautiful success story. Let me just get back to your biggest challenge one more time. You said the revenue is an issue, right? Right now, looks like it is basically sponsored by some generous beings. Is there a revenue stream that can perhaps make it sustainable in the future?
I wouldn't say the revenue is a challenge, but I will say that it's a new model. And we're fortunate that it's a model that really works. We're solely supported through advertising and sponsorships and just organizations that have a brilliant idea that want to share it, and they sponsor an episode to share that. I would say that revenue model has been very, very beneficial for us because not only does it support the work and the reach of the journal, but it also covers the cost of submitting to the journal and for the readers to really view it without any additional charge to them. It takes away that barrier. And I think, like I said before, healthcare is a community effort. We're all patients at the end of the day. So seeing these organizations work with us to really provide this beneficial content to the readers and those that want to share, I think that's very beautiful of them to do. And it really supports the mission of AJHCS.
Okay, I see it now. I think I had mistakenly assumed that the sponsors were more of a philanthropic donations rather than sponsors, but you're talking about for-profit companies that are sponsoring your activity, making it self-sustainable as it grows bigger and bigger, right? So for you, based on your experience, and we are a health tech podcast, I have to ask you this very question. In next 5 years, how do you think the healthcare strategy is going to evolve, considering we have so much of AI input? And I see a lot of positive things with the AI and how the technology is evolving. What is your perspective on it?
Yeah, so I see a lot of changes. These changes are being implemented every single day, and I tend to be guilty of doing a lot of research on where things are going, really the industry trends. I'm a big fan of not just how things are evolving in America, but also globally. I was reading the story about how say a patient comes to a hospital, they park, they go to their appointment. If they haven't been seen by the doctor yet, say the doctor's running a little bit behind, rather than having a ticket that needs to be validated or even just renewed, or they had to pay extra for the parking, there's a sensor that automatically knows that the patient has not been seen by the doctor yet, and it automatically renews, so nothing has to be done from the patient end. They just go straight to their car. And I thought that was beautiful. That's very revolutionary. It's the small things you don't even think about. A lot of the solutions that are out there, say like AI scribing is a big one. Digital check-in, that's been a big one recently as well. These are things that happen usually within the hospital, but something outside of the hospital, like just renewing a parking ticket. That's usually not really thought about. So I see a lot of potential, especially in areas where we're not looking. There's potential in every single segment of the healthcare industry. So I'm really excited to see where things can come. And I motivate everyone to really be a part of that change.
That's awesome. What I appreciate here, Syed, generally when I'm talking to healthcare providers and healthcare industry, we are talking about this big thing. So this is the most innovative technology that we have had in like 25 years, right? Yes, the problems have to be solved. Those are really important problems. But something like, say, your ankle is broken and I have to go 50 feet away to get my parking ticket validated is a big issue for that patient at that moment. And if we can avoid that 50-feet walk that is taking care of your patients, it has been pretty enlightening on the part that although there are people who are working on like very complex solutions, but we have to work at this level where the rubber hits the road and the patient's experience in the clinic and the hospital. So my final question for you, a question from my side, is what is your advice for health tech entrepreneurs watching this, right? How do you think that we should be navigating healthcare ecosystem?
I would say it's really maybe not so much to focus on the trends of where healthcare is going, but really to focus on your own utopia of what healthcare should be. Not many innovative companies really looked at what other companies are doing, seeing where what's going to be popular. Many of the most brilliant companies really just created their own path, rather than trying to compete in a tough area. They went ahead and created their own blue ocean, and that really gave them opportunity to sail to more growth. So I would really inspire everyone to focus on their own healthcare utopia and seeing what you can do to get us to that utopia given our current circumstance. Not to say that's not important to do the research, see competitors in that field, see what you can do that's not already being done, but more so to envision the perfect healthcare system and whatever that could mean to you. I'm sure everyone has different definitions of what that is. Yeah, a funny thing about the journal is that we always say that we're not the brilliant ones, because we have people sharing their brilliant ideas just on our platform. We provide the platform, but the guests are truly the innovative ones that are really shaping the industry. So I would say just imagine what healthcare should be and what you can do on your end to really get there, and take a look from the patient's end. Listen to the patient, see what they have to say. Yeah, just focus on how we can get there.
That's a very wise advice. Create your own path instead of trying to compete in a crowded area. That means that you have to do your homework. You have to understand the system. You have to really find that pain point and find a solution for it. And if there is no solution in that, and perhaps a good source is AJHCS. When you listen to the patients, maybe that's where the pain point is. You are just providing a platform for all these brilliance to come out. And I think that's my intention also with the HealthTech Heroes, just creating a platform for all this brilliance to come out. So thank you very much for that. With that, I would love to have this last 90 seconds for you to plug in AJHCS, like whatever you have to say about AJHCS for my audience and your audience. It could be something promotional, and definitely that's welcome too.
Yeah, everyone is able to come up with an idea, something innovative. A big challenge in my life was really finding people that would listen to that idea. So I would inspire anyone to really come on to or just submit your ideas to the journal, see who would listen. I know early on when I was doing some research, I had to be tagged along next to a well-known figure in the research world before my paper could get accepted. And this usually comes at a cost where I'm usually last author due to experience. I don't want that challenge to come for anyone, So say you're an undergraduate, graduate school, or you're very well on in your career. This is a community for everyone to share ideas, without any obstacles, no barriers to cost, no barriers to read and learn. And this is really just a very innovative platform to just come and innovate. So I would inspire anyone to really come in and let us hear what you have to say.
And thank you very much, Syed. I think, as you said, everyone is a patient, and you want patient voice in there. And so basically, it's for anyone, even if a healthcare provider You can come as a healthcare provider bringing your idea, or you can come as a patient providing their insights as well. So that's wonderful. It was amazing talking to you, Syed. So again, I appreciate your time, and hopefully we will talk again on this platform.
Of course. Thank you for having me on.